My name's Jennifer Jamieson and I'm an emergency physician here in Australia. I have been working at Monash Medical Centre as an emergency doctor and at the Alfred Hospital as a trauma physician. I've worked with MSF in Afghanistan, in the northern part of the country, in 𝘑𝘮𝘯𝘮, that was in 2012, and I've also taken some time to live and work in East Africa, in Tanzania and 𝘑𝘬𝘮𝘮. When I was working with MSF in Afghanistan, I actually got deployed as an intensive care doctor. Not that I was in any way a qualified intensive care doctor, but I had experience working in ICUs. And so my primary role was to try to look after the 4 HDU beds. And we had a couple of very basic ventilators for which we sort of selected a couple of patients that we thought were appropriate, such as the chest injured patients, head injured patients. And they were mostly young people that were easily put on a ventilator and easily taken off. And I also helped obviously in the emergency department a little bit with some of the high acuity trauma, and in our mass casualty response I was in charge of what we call the red zone, or a sort of tier 1 most severely injured patients when we had a mass casualty. And sometimes we would have 40, 50, up to 70 patients arrive at one particular time, and we would have to be able to deal with that sort of surge in a hospital which had fairly limited capacity compared to any Australian and New Zealand hospital, but in terms of MSF hospitals, it's quite well equipped. The other main project that I did when I was overseas was working in Tanzania, where we were, my husband and I were based in 𝘑𝘬𝘯𝘯𝘺. I worked at the National Hospital there, 𝘑𝘬𝘯𝘮𝘮 National Hospital, which has something like 1,500 beds. It's enormous. And the emergency medicine department there has been in existence for a number of years now, and they've got their own emergency training program, a 3-year training program which they put a lot of Tanzanian and other East African residents through. And so my role as a volunteer there was really to sort of help support that, help with some of the education work, and a lot of sort of health system strengthening work around there. I was always interested in global health work because as a child we travelled around the world an awful lot, and we lived in a number of different countries. So I probably had an interest in travel and other cultures from an early age. But certainly as a medical student, one of the things that really triggered my interest further was the medical elective, which I spent in South Africa in one of the townships in the hospital there. And that also triggered my interest in trauma as well. Prior to that, I had thought I would be an infectious diseases physician, and it was actually my time in South Africa that really made me quite intrigued about emergency medicine and trauma. The other thing that really sparked an interest in global health was, again as a medical student, when the AMSA Global Health Conference was starting to come into existence, and that was around the time I was a student. And then we were fortunate enough to host it in Melbourne during one of I think it was my final year as a medical student, and that brought me into contact with a lot of like-minded students who were also interested in the same area. Alongside global health, one of the other things that I'm really passionate about is addressing gender equity, and I'm involved with one of the college committees, the Advancing Women in Emergency Medicine Executive, whereby we try to focus on some of the challenges that women in emergency medicine might be experiencing, and we provide a lot of advocacy work around that. One of our more recent works has been to actually try to put through a gender equity policy for the college, and we think that this is something that's really important, that every medical college should really have these days. So that's been one of the things that I've been heavily involved in. Of course, it can be really difficult when I'm involved in global health to take some of these passions or some of this advocacy work and translate that to a completely different global landscape, a completely different cultural setting. In Afghanistan, obviously, it can be the polar opposite to here in Australia. And for me to come in with some gender equity views or proposals is not exactly something that I would want to do, and it would probably undermine a lot of the working relationships that I'm trying to foster and nurture when I go to a different place. It's not to say that those conversations can't be had, but they need to be had when there's a relationship there, and people know you and understand you, and that you're not just thrusting these ideas in their face and that you come into their country and their culture. There's certainly been a lot of advocacy work in recent years, even things such as the 𝘑𝘬𝘯𝘯𝘺 movement, which sparked a lot of focus on sexual abuse, although there were still criticisms around that movement in terms of it being very much from a white Hollywood celebrity perspective. It still did spark a lot of focus on sexual abuse, and in particular some of the issues that women face in their workplaces. So there has been a lot of dialogue around gender inequity. In terms of where we go now, we need to actually have some meaningful steps, and a lot of that is going to have to come from broad systemic change in organisations, in working cultures, and in society at large. And that is probably where it's going to be the hardest thing to try to address, or the most difficult thing. Yes, it starts with dialogue, but then it has to be followed up with some meaningful action. In terms of balancing my clinical practice and my global health practice, it's been much more challenging of late, as you can see from the little person attached to me here. When I was working in Afghanistan, it was certainly pre-kids and pre-marriage, and when we were in Tanzania, it was pre-kids as well. So we had free reign of what we wanted to do and what we wanted to focus our careers on. And now we've got some dependents at home, and it can be a little bit difficult. It's certainly not, I certainly can't rush off to a war zone right now and be working with MSF. Probably could, but it'd be very, very difficult with a 6-week-old. So what I have to do is look at global health more broadly and look at some of the things that you can do at a local level. For me, that's been getting involved in some of the medical colleges, so my own college, the Australasian College for Emergency Medicine. So that's been something that I've been quite passionate about, whether it's been arranging lectures or talks, workshops, supporting projects around the Asia Pacific, sometimes even doing publications at a local level for the college, profiling different physicians who have been off doing amazing work around the globe. So that's been my sort of spiel with the college. I've also been involved in some workshops at a local level through Monash Health and Alfred Health, particularly the Global Emergency Care Conference and Workshop, which is usually run annually in September. And we do run a one-day workshop where we focus a lot on field work and what it's like to work doing things like needs assessment, log frames, and advocacy work in the field. When I came back from doing some global emergency work, someone told me that getting involved in global health on a local level was a bit like being on a methadone program, because you're not getting the thrill and the experience of all that sort of work in the field and the day-to-day excitement. So you're toning it down quite significantly when you're here. But that's not to say that you don't build those same networks and relationships, and you encounter people who are in the same phase of life as you, where they may not be able to go overseas at this particular point of time or go to a low resource setting and work. So there can be a lot of benefits to actually engaging at a local level. When I came back from working with MSF, my first shift in the emergency department, I had two very funny things that happened to me. One was a guy who came in with a bruise that he wanted looked at, and there was no significant risk factors for any sort of clotting disorders or anything like that. And I remember thinking, my goodness, the luxury of being able to attend an emergency department just to get a bruise checked out is incredible, and he was seen within sort of 20 minutes. So that was one thing that impacted me on my first shift back. And the second was that we got this call from pathology saying that the high sensitivity troponins were going to be a little bit delayed by about 10 minutes. And I remember standing in the middle of the emergency department thinking, what world have I come back to? The privilege and the luxuries that we have here go unnoticed by most of us every day because it's just the norm. And of course, when you've come from an area where you just don't even, if you have a blood test, it's it's the most exciting thing that you can get all day. You think, great, that's wonderful. And to contrast that to here in Australia is, it can be quite confronting. So I think every now and then I try to have a rain check in the middle of a busy clinical shift, when maybe things are taking a bit longer or that CT is delayed by 10 minutes. I do try to take a rain check and say, we are so fortunate to be able to have access to all these resources and such a wonderful healthcare system. But of course we have a difference, we do have a different standard that we live up to and different KPIs that we live up to. So it's always striving to do better wherever we are. If you're interested in incorporating global health into your medical career, one thing I would say is don't underestimate the ability of getting involved as a medical student, because as I highlighted before, some of the lasting friendships that I've had have been from my involvement as a medical student in various global health sectors, whether it was the AMSA Global Health Conference or whether it was the Global Health Group involved at a university level. So get involved as a student because that may have some lasting effects. Secondly, there will be times in your life where you need to focus on medicine or your career, and perhaps global health will take a little bit of a backseat, and that's okay. As long as you're surrounded by opportunities and people who may sort of foster and nurture that interest, I think that's the most important thing, because then you're always going to be able to come back to it and come back to it at a time which suits you. One thing I would say with work-life balance is that give yourself permission to focus on particular things at particular times. So what I mean is sometimes there'll be instances in your life where your work or your study is going to take priority, and that's okay. Just focus on that, and your friends, your family, your other relationships, they will understand, or they will survive that. There will be other times where work is not the most important thing that's going on. There may be other circumstances that are happening in your own life, in your family, in your friends, and other wider circles. And it's really important to focus on that rather than getting hung up on every little aspect of work or study or trying to further your career at that particular point in time. So just give yourself permission to be in that particular space. So whether it is focusing on your friends and your family or focusing on your career and study.